I see the doctors here, especially Dr. Udai Prakash and senior Dr. Ved Prakash ji and all the doctors who are involved over here. Now I can see this hospital, the doctors involved, they are not only the healers but also they are acting as the innovators. They are commanding the robotic arms now using 3D vision to see the human eye cannot see, and also to make the real-time analytics to make life-saving decisions. And this wouldn't have happened if there was no technology. And I always believe that any technology which we use is not about man versus machine. It's about, I believe that the man with machine, absolutely as a doctor for mankind. And I always believe that everybody who uses technology should have extraordinary possibilities in terms of knowing, in terms of learning. And I always see that the precision always brings down the complications. And minimal invasive procedures also means a quick recovery and also relieves pain. It also indicates the safest recovery with less infection risk. And with innovation comes lots of responsibility. Maybe I'm here, I was here, everybody knows here, a couple of times I was here to seek doctor's appointment in terms of a patient who was undergoing a treatment here. First is, any doctor would do the best in themselves to save or to do the best surgery. But here, people come to us and they believe in us that if I come, doctor may attend to more attentively. So I was explaining that same thing to the doctor that day. I know how professionally you work, but the empathy what they get from, if we visit a doctor, if we visit a hospital and consult the patient and talk to a doctor, that gives lots of the confidence. That's the real reason I was here twice here, and I was asking for one more favor. I always keep calling my doctor also, Dr. Vinegar, to talk to some doctor to make the concession in your field. So here I always see the innovation, because here the doctor would have put most of the capital in this, the new innovation which has been there. But here comes lot many challenges, right? We must, even though it sounds odd for somebody, but it's, as a policy maker, we always tend to see that the people should get the best of the medical facilities and healthcare at the minimum affordable price, so that every patient can benefit. Sorry to say, but that's my. And I always see that when innovation comes, doctors should be so trained and confident in using this tech. Until they are confident in using the new modern technological tools, they will not get the 100% result. And we must also try to bridge the access or the gap which we create. The smaller towns and the rural towns should not be left behind. So innovation always pertains to the tier 1 cities and towns. And as you have done, we must seamlessly integrate and embrace technology into our hospital workflows and administration. And above all, you're always maintaining and trying to do that. We must maintain the human oversight in every decision. And I believe our government, especially in Telangana, we see challenge not as an obstacle, but we take challenges as an invitation to lead. And just imagine, we have got the legacy from a difficult situation, but still we are trying to lead this state of Telangana with our Chief Minister and my colleague ministers, trying to enrich the quality of our lives of the people as best we can. In the process of legacy, we have many challenges, but we think that it's an invitation to lead to overcome these obstacles. And I would like to say that in worldwide, statistics prove that the robotic surgery market is growing about 50% annually, and also in terms of commercially, it would reach about 18 billion by 2030. So lots of potential in this robotic surgeries. In India, we are growing even much faster, 20% year on year growth. And in advanced nations, about 80% of the prostate surgeries are now robotic based. And I see, innovation like this, an indigenous robotic machine like this, and the proactive government on hand. We see this Hyderabad can become a global IT hub, and that too, with the initiative from Udai Omni hospitals, we can become the centers and also the Asia Center for Surgical Innovation. Because you people are so inclined to imbibe, embrace and integrate technology. And over a period of time, we have built IT corridors, electronic clusters, AI research hubs, what we are doing, and also seamless administrative frameworks to drive industrial growth. Now we are applying the same innovation culture to healthcare and trying to put technology, and also see that we have got a new tourism policy which has a component of medical tourism intervention. So this will also encompass and try to see that this healthcare which is best available, and I just was trying to put it the least affordable rate. I don't think what Dr. Udai Garu was trying to mention is, if suppose if the same model of robotic arm, if something can happen in 4 or 5 lakhs or 6 lakhs, but in Europe and US it would have costed 20 to 30 lakhs. He is the best man to say because he worked in London.